Well, good afternoon to all of you, and I'm so happy that I'm amongst my quite a few honored colleagues over here. And right on the front row, I can see so many: Dr. A.K. Agarwal, Dr. K.K. Agarwal, Dr. K.K. Kalra, Dr. O.P. Kalra. Everyone is practically known to me, and I'm feeling very happy. I'm feeling like coming home, for this talk. I have been asked to talk on medication safety, and I have extended it to issues and measures to ensure patient safety as far as medication is concerned. Because a lot is known about infection control. We know that from where the infection comes, but one feels absolutely lost, when it comes to the medication. And when somebody talks about the patient safety, medication safety, there is only one thing which comes to somebody's mind, and that is medication error. And that is the basic thing which has blown up so much, and it needs to be blown up so much that everybody has started talking about medication safety. So I will just give you a bird's eye view as far as medication safety is concerned, and try to do the justice as well as finish up my presentation in time. As far as WHO is concerned, the safety of medicine is an essential part of patient safety. Global drug safety depends on strong national system that monitor the development and quality of medicine, report their harmful effects, and provide accurate information for their safe use to doctors as well as to the patients. So that means it involves quite a few things if you really want to ensure the medication safety in the patients. Why medication safety is required, why it is so important. Several studies from various countries have shown that 3.7 to 16.6% of total hospital admission were associated with adverse events, and a substantial proportion of which were attributed to medication use. This is the expenditure which has been shown in America, and you can see that so much has been spent on hospital admissions, on physician visits, prescriptions, nursing homes, emergency visits, and a lot of money is being spent on these adverse events due to medication. Continuing the same, why medication safety is so important, and most of you know about it. To err is human, building a safer health system. This report was published in 1999 by the Institute of Medicine, and in this report, it was actually the landmark in the history. That this report actually said that 98,000 deaths per year due to medical errors, and out of them 7,000 deaths every year occurs due to medication use, quite a substantial number, and this actually has awakened the whole globe, I would say, and that was the reason. And reason that even medication was, it was realized that medication is also important and that should be given proper consideration. Then it comes medication management, because NABH, I'm really thankful to NABH that it has brought medication in the front line, and actually in World Health Organization, this is number 3 goal, which JCI and other quality taking care of organization taking care of quality, they must look into the medication management. It's a very, very important agenda as far as WHO and NABH and JCI, all these organizations are concerned. So they talk about medication management. It's a 3rd chapter in NABH manual, and it is medication management. It contains many things, and which I think I'm going to touch each one of them briefly. Medication management in hospital encompasses the entire way that medicines are selected. Remember, it starts from the selection, procured, delivered, prescribed, administered, and reviewed, and used by the patients at home and in the hospital. So it's a very big cycle, and there are so many stakeholders in this. And any problem occurs at any stage, can cause harm to the patient, And let us look at this whole cycle. First, we procure the drugs, we store them, and selection is missing. It is very, very important. It should be there. storage, prescribing, indenting, dispensing, administration of the drug, disposal of the drug. And sometimes somebody asks me, why do you say the disposal is important? Yes, it is important because the drugs you are using for cancer are drugs for using for certain other drugs, which requires to be disposed in a proper manner. And if you don't do that, they go into the drinking water and they will harm the patients, or they will harm the community. So disposal is equally important. It's not that you are administering the wrong drug, because not only that wrong drug has been prescribed, wrong drug has been administered, and that can only cause the medication errors. But in other other stakeholders are also involved in causing medication errors. There are certain key issues which we need to address when we are talking about medication safety. And each one of them is directly or indirectly causing harm to the patients. How? I will explain that. Hospital formulary, in most of the hospitals, whether it is government hospital or it is a private hospital, it doesn't exist. Corporate, those who have undergone NABH, JCI, they do have hospital formulary. Government of Delhi has a essential drug list, but not, in that manner it is being taken and it is being used. It is very important, and not only having the list is important. Remember, managing the list is very important. Continuing the list is very important. Seeing to it that we are having drugs which are efficacious and safe and cost effective. They are there. They are regularly reviewed, and they are absolutely based on evidence. We should not go by, by saying somebody saying, say that this drug is very good and we should include in the formulary. Selection of medicine is not evidence-based. Pharmacy is managed badly and essential medicines are not available. Now, if the pharmacy is not being managed properly, and when we say pharmacy is not managed properly, I'll come to that little later, then in that case also that would indirectly will cause harm to the patient. Medication error reporting is very poor. Everywhere it's very poor, and not in our country and our hospital. All over the world, it is very poor. Medicines are used irrationally, and we have seen the case of antimicrobial, and other drugs are being used irrationally. When the drugs are not required, they are prescribed. Most of the time, we get influenced by the medical representative, and we keep on prescribing those drugs. Standard treatment guidelines, if they exist, they are not being followed. Adverse drug reactions are not being reported, not being observed, not being monitored, not being treated. So no pharmacovigilance. We do not have trained pharmacologists, clinical pharmacologists and pharmacists to manage the medication as far as in the hospital is concerned. Medication safety, one of the key components of patient safety, yet medication use is ignored or taken lightly. We hand over the purchase of the drugs, procurement of the drugs, in the hands of those who are not trained, who are not knowledgeable. We ask somebody to come and sit in the committee who does not have the experience to select the medicine based on evidence, based on safety, and based on efficacy. We just pick up anyone and come and please select the drug. Oh, this drug is good, please include in the list. That should not happen. So, it is important that we manage it. So, what are the questions? Every hospital must have pharmacy and therapeutic committee, and in some countries it is called drugs and therapeutic committee. When I was head of department of pharmacology, and I was trained in this pharmacy and therapeutic committees course, I attended twice this course by World Health Organization, and the first thing I came back from WHO and I asked my DHS at that time, Dr. R.N. Bashir, that we must have a committee, pharmacy and therapeutic committee. It was formed, it worked for 6 months, and where it went away, God only knows. In Maulana Sahib Medical College, I was instrumental in constituting the committee, pharmacy and therapeutic committee. Response was very, very, very poor, and everybody started asking, why another committee? There are already so many committees. So that is a thing, every hospital must have to address all these issues, and committee must have members from different disciplines. It may be microbiologist, the nurse, or whosoever, whatever is that they have to be there. Now, what are the other interventions that we can do? We can take care of that. And I will give you example of each one of them. Hospital formulary, if you have not selected the drug rightly, you are giving wrong drugs to the patient. Irrational combination to the patient. inefficacious drug to the patient, having more side effect to the patient. So selection is very important. In the pharmacy, if you are not storing them properly, then what you are doing? In that case, you know, this was hospital formulary. I'll jump to hospital pharmacy. If you do not store the medicine properly, proper temperature, I would like to ask, in how many government hospital pharmacies have controlled temperature 25 degrees? I have seen my stores, I have seen many stores, maybe now over the last 5-6 years, things have changed. But boxes are lying on the floor. They are dumped, you know. There is no system of store management. Pharmacists are not trained. So, what is, if that happens, the drug loses its potency. Drugs is either it turns into a toxic substance, it will cause harm to the patient. So we should have pharmacists, they should be trained in store management, should follow good storekeeping practices. And we have in Delhi State, we have conducted on behalf of DSP R&D not less than about 7-8 training programs for pharmacists how to run the good storekeeping practices. Efficient inventory management takes care of stockouts. And if your stockouts are not there, your patients are happy. And that's the quality service. Having formulary, list, and well-managed pharmacy ensures availability of medicine at all times, adds value to the quality care. Right? Patient may not get medicine, may not get efficacious medicine, may have a drug which is not efficacious, which is less efficacious. Patient goes back home, keeps on taking antibiotic for 7 days, but doesn't have any effect. What is that? That is again a kind of a, we can say it's an error that has taken place here. Appropriate prescription writing is a very sensitive area. And I always say that when everybody lands in 3rd year, that is the first lecture that is being taken, how to write a good prescription, what are the components of good prescription, and what is the value and what is the importance of each component of good prescription. But still, you will find day in and day out, prescriptions are incomplete, not legible, and so many errors. So therefore, we have to write a proper prescription, proper drug name should be given, strength should be given, dose should be given, frequency and duration of treatment. And it's better if you can prescribe by generic name. We should not write milligram, grams, we should write micrograms, nanograms, whatever it is. Quantity less than 1 gram should be written in milligrams, for example 500 milligram, and not 0.5 grams. So these are some of the examples. Medication error. Now, medication error is any preventable event that may cause or lead to inappropriate use or patient harm. While the medication is in the control of healthcare professionals, patients are consumed. In other simple word, it is use of medication that does not conform with its actual recommended drug, dose, frequency, or route of administration. Just few case studies I will give. These are real case studies. Injection amiprone, which was supposed to be diluted in 5% dextrose, was diluted in 100 ml normal saline. As a result, because it is not supposed to be diluted in dextrose, patient developed local reaction, and there was patient developed a lot of swelling in the arm, and the reason was no dilution instruction was mentioned in the drug chart, in the patient's drug chart. And doctor did not prescribe, nurse did not know, and whatever she felt, she did it. And then they started blaming the drug is spurious, and that is why it caused harm. So, instruction from the doctor is not there. Now, here is the instruction of the doctor to the patient. A diabetic patient came to the hospital severe hypoglycemia, and on taking history and examination, it was found that the patient was diabetic and taking oral hypoglycemic agent. But for the last 2 to 3 days, the patient was not taking anything because he was in a lot of pain in the throat, so could not take anything, but he kept on taking anti-diabetic drugs. So net result, he went into hypoglycemia. So no instruction was given to the patient that if you don't take food, do not take oral hypoglycemic agent. So lack of education to the patient. Patient suffering from osteoarthritis was prescribed non-steroidal anti-inflammatory drugs. Patient felt comfortable, kept on taking for 3 years, and came back to the hospital with the acute renal injury. And whereas nobody gave the instruction, do not take non-steroidal anti-inflammatory drugs continuously more than 10 days. They should not be taken. Because I have seen that even ibuprofen also can cause rise in blood pressure within 3 to 4 days. This survey I have done myself. So we should not keep on continue, go on taking the drug. We should advise the patient properly. Come back to us after 10 days, 15 days, we will review your prescription. That was not done. This is another 25-year-old patient. The prescription was not legible, and developed itching all over the body. She was prescribed fexofenadine 180 milligram at bedtime, but patient could not read it properly and kept on taking 3 times a day. So this is what happens. But then what is the outcome of medication error? Medication error leads to adverse drug reactions that could be mild, moderate, or severe. There may be therapeutic response, lack of therapeutic response. If drugs are not given on time, or drugs which have low efficacy are given, with lack of response. There is a prolonged stay in the hospital, increased cost of treatment. So what should be done? Hospital must have policies on prescription writing, dispensing, administration of drugs, medication storage, how to handle high-risk drugs, what should be done, how they should be taken care of, and managing look-alike and sound-alike drugs, because they are the major one to cause medication errors. A little few words, one slide about adverse drug reaction. It is a response to a drug that is noxious and unintended and occurs at doses normally used in patient for prophylaxis, diagnosis, or therapy of disease. This definition is being given by World Health Organization. Now, another thing which I must say over here, do not mix up adverse drug reaction and medication error. Medication error is 100% preventable. Adverse drug reaction are not 100% preventable. Drugs have the inherited property of causing side effects. So, we cannot completely remove them, but we can prevent them. It has been seen that 30 to 40% or 50% adverse drug reaction can be prevented. In USA, the 6th largest cause for mortality and percentage of hospital admission due to ADR in Western countries. 10%, 30 to 50% are preventable. There is a very limited information in India, although I don't want to say because there are my colleagues who are sitting over here and they know that what is the system like we have in our country. All drugs are capable of producing adverse effects. Let it be even vitamin D complex or even vitamin C. Adverse effects may develop immediately or only after prolonged use of drugs. Adverse effects are not rare, and incidence of 10 to 25% has been documented in clinical setting, and this has been seen in India also. But what is important? Reporting is very important. That is very important. They are very common with multiple drug therapy. Chances of ADR increases when drug is given for a long time. Patients suffering from allergic diseases are more prone to develop drug allergy. Reporting of ADR, that is pharmacovigilance, is very, very important. And why it is important? Had pharmacovigilance was not there in other countries, drugs like thalidomide, benoxaprofen, terfenadine, rofecoxib would not have been removed from the market. So that is a result. And that indirectly means safety, medication safety. Drugs which are not safe, which are causing adverse effects, they must be removed from the market. But this culture of reporting adverse drug reaction is practically zero in our country. Because doctors have the fear, I think, from this association, from this medical council, must send the message. It is nobody's fault. One should not say it is a doctor's fault who has prescribed the medicine, that is why they are causing harm effect. And not only the drugs are withdrawn, but their instruction to the patient, to the doctors are also changed. As you keep on getting, adverse effects, you go on adding in the PIL and doctor's information note that this can also happen, this can also happen. From our country also, so many drugs have been withdrawn. Standard treatment guidelines. We have standard treatment guidelines. We have seen them, we have developed them, we have used them also. But the use is not that uniform, or that kind of is not accepted so much. There is standard treatment guideline, they call uniformity in treatment, patient get best treatment, and selection of the medicine is evidence-based. Medicine including the STG become part of formulary list, and better pharmacy management. One should have hospital antimicrobial policy, and this I will not touch it. Coming to the conclusion, it is important that a multi-pronged approach is adopted to ensure medical safety in any healthcare setting. Let's not restrict ourselves that the doctor has prescribed wrong or nurse has administered wrong, only then medication error can occur. Medication error can occur due to fault at any stage of medication management cycle. That is very, very important. Several studies have shown that appropriate prescription writing saves many medication errors and ensures patient safety. There is a need to be close observer as far as pharmacotherapy is concerned. It enables to pick up adverse drug reaction and ensure an effective use of medicines.